just before we started, I want to get kind of like a show of hands from like what backgrounds people are coming from. So who is like a physician assistant, resident? Can you get a show of hands? All right. And how about physical therapists? Okay. And athletic trainers? All right. And who's just here because they're interested in sports injuries but don't have a lot of medical knowledge? All right. So we got a little mix of everything. So, and that's kind of what I prepared for. So I think what I'd like to do is start things really simple so everybody gets on board. And then as we go on, they'll get a little more complicated. And feel free to stop me in the middle of the talk if you have any questions. And also, after I talk, Laura's going to talk about return to play after ACL. So then after that, we'll have about 10 minutes to discuss both the talks. So if anyone has any kind of questions at the end of that, be happy to like answer that in the discussion format as well. So what I'm talking about to you guys about today is ACL injury prevention, and this is something if you guys are DC natives or if you are Redskin fans, this is one of the dark days in Redskins history here, and we all remember this day, but that's what we're trying to prevent today. So this is RG3 re-tearing his reconstructed ACL. So what is the ACL? So the ACL stands for anterior cruciate ligament, and it goes from the anterior tibia to the posterior lateral femur, and it's right in the center of the knee. There's a big giant blood vessel that goes in the center of it that gives it a great blood supply. But it also means that when you tear it, you get a very, very swollen knee because it just bleeds and bleeds until the pressure builds up in your knee, and then it kind of stops bleeding. So people come in, when they tear their ACL, it's not like, oh, I was jogging and I think I might have torn my ACL. It's actually more like, I felt a pop in my knee, I went down, and then I couldn't get back up again. Someone had to help me off the field, or I definitely couldn't go back to play in the sport. So sometimes we have people where they have been found to have ACL tears on an MRI, and I often tell them, like, have you hurt your knee before? Because if they come in saying, like, I was jogging and then my knee started hurting, and then I finished my jog, and then when I came home I was like, oh, it's a little swollen, that's probably not when they tore their ACL. So it really does two functions, and it prevents anterior tibial translation. That means the tibia is a shin bone, so it prevents the tibia from moving forward relative to the femur, and probably more importantly, it prevents abnormal rotation of the knee joint. So why do we care? Why are ACL tears so important? Anybody in the room have an ACL tear that they want to share? All right, well, one. I actually expected more than that, two. Okay, so three. All right, so we got people here with ACL tears, and they're very common. It's one of the most common injuries in sports, and as our population gets more and more active, as we emphasize things like team sports, it becomes even more common. And we estimate that even as many as 250,000 tears a year in the United States. People who tear their ACLs, it's not an isolated injury. So usually when you tear your ACL, you can injure your cartilage, you can injure your meniscus, you can injure other ligaments as well. And so this combination of things leads to an increased risk of osteoarthritis as you get older. The other thing is that people who have recurrent instability of their knee, or people who have an ACL tear and lose confidence in their knee, can oftentimes have trouble getting back to sports. It was estimated in 2000 that the cost of ACL reconstruction in our country alone was $1.5 billion. And that's kind of based on an assumption that about a third of people who tear their ACLs have surgery. And return to sports can be very variable. So everybody who comes in with an ACL tear has heard of Adrian Peterson, and they want to go back just like Adrian Peterson did and come back and be the best, running back in the NFL. But they've also probably heard of Derrick Rose, who took much, much longer to come back to sports. So there's a big variation. You do the same surgery on different people, and it doesn't always work the same way. So it can be a long time sometimes before people are ready to come back to the same level of sports. How do ACL tears occur? So what we think about a lot are these contact injuries. So this guy playing rugby gets hit in the leg. So I would argue that for all of us in the room here, if we got hit like that, it would cause some serious damage to our knee. So that's not really something we're going to prevent. You can be as strong as you want to be, work out every day. Somebody hits you like that, you're probably going to hurt something. But what we're talking about preventing are these non-contact injuries. So more commonly, ACL tears actually occur before you get hit, or unrelated to any kind of impact injury. And so those are the ones that I think we are focused on in terms of sports medicine in preventing these injuries. So there's a proposed mechanism of ACL injury here. And so I found this video. It just kind of shows the soccer player kind of planting and kicking the ball. And this is just kind of zooming on the ACL. So below, you know your tibia, above your femur. ACL is right in the center. What they'll show is that this guy's going to plant his foot, and as he rotates, you're going to get some rotation of the tibia, get some rotation of the hip, and the foot, and all that. It's kind of like a perfect storm of things that happen, and then the ACL tears. So it's not like any one thing happens, and we'll cover that in a little bit more detail, but I just thought it was a great video. So this is another video of an ACL tear. So this is Sam Bradford. I can't remember if this is a re-tear or his first tear, or maybe a second tear. But so you can see here, why am I calling this a non-contact injury? Because he's getting hit, right? So this guy's hitting him as he's going out of bounds, but nobody's hitting his knee. So he's just kind of getting pushed. And what we can learn about this video is a lot about how Sam Bradford plants his foot when he gets hit. So people who tear their ACLs tend to land on their heel or with their foot flat. So you're landing down here like this, rather than on your toes. And they land with their hip flexed, so their hips up in the air like this instead of straight out. And they have a valgus load. So valgus is basically like the knee going in instead of going out. So it's like all of those things combined, and usually the planted foot is pointing outward. So actually, it's hard to see his foot very well. At the end you can kind of see it, but he pretty much has all those things when he tears his ACL. So what is it about landing that tears our ACL? So landing forces are a lot. If you take a person and you have them jump and land on one leg, they actually exert about 2 to 18 times their body weight, depending on how high and how hard they jump and land. So if you take an average person, which is about 70 kilograms, and they land with 5 times their body weight, that's kind of like a average jump, we would say. That's 3,430 newtons of force, and newtons is kind of how we measure force. To tear your ACL, you only need 2160 newtons. So why don't you tear your ACL every time you jump and land on one leg? Well, you don't, right? Otherwise, I don't know how we would prevent these things. Well, what happens is when you land on your toes, then as you land, your foot comes down flat. And so what that allows is for your calf muscles to absorb that energy from landing, so that you don't put all the pressure on your knee. But when you land on your heel, your calf muscles are not as helpful, so that puts more stress on the knee. And this is kind of an example of a safe versus an unsafe landing. And you can see here, so this is a safe landing. The guy's landing on his toes. He's got his hip relatively straight. And then if you look at the tibial plateau, so the ACL kind of sits like this, from here to here. And if the tibial plateau is flat, that's not really going to put as much stress as if the tibial plateau is going up like this. So here the tibia wants to go forward, and the femur wants to go back because of the slope of this. It's kind of like sliding down a hill. And so here the hips flexed, and they're landing on their heel. And so these are some of the things where we think maybe we can change about people so they can prevent ACL injuries when they're jumping and landing. It's unclear how important valgus is on the knee, but we know that almost all ACL tears involve some kind of valgus mechanism. When you put your knee in valgus, if you think about it, if I'm standing up straight like this, I'm putting the weight relatively through the middle of my knee. But if I put my knee in valgus, it starts going over to the outside of the knee. And inside the knee, the medial side of the knee joint, which is the inside, is really tight, and the outer side is a little bit less constrained. So that puts the potential for more rotational force on the knee. And then if you couple that with when you land on one side, if you lean over it a little bit, like if you lean onto that leg, then you put even more force on your knee. The other thing is your bony anatomy. So some people are just born with bones that are shaped a little differently than average. So if you have a tibial slope that's kind of like going down, then even if you land flat, you're kind of putting that same force like I showed you with the unsafe landing. So in dogs, for example, when your dog comes in with an ACL tear, the vet actually often does an osteotomy. So they cut the bone and reshape the tibial plateau so that it's flatter. And the idea is that puts a lot less stress on the ACL. We generally don't do that on humans, but it adds a lot of surgery and, of course, pain to the injury. And why do females tear their ACLs? Well, there's a lot of theories. So females, in general, tend to have looser joints than males. They tend to hyperextend their knee more, which puts it at more risk. They have higher tibial slopes, which we just talked about. And then there's some thought that maybe even estrogen levels play a role in whether you tear your ACL. So at the parts of the time during the menstrual period where your estrogen levels are higher, your ligaments are actually a little bit more loose, and so then you can risk tearing them. So what do we do to prevent these ACL tears? Well, there's really a few things that are really options that we have today. So one is a brace, two is an ACL injury prevention program, and three is just to stop playing sports, right? So if you just walk around, sit on the couch, you're not going to tear your ACL unless something kind of freak accident happens to you. But I think most people don't really want to do number three. So let's talk about number 1 and 2. So you guys might think I'm running out of slide pictures to show here, but I'm trying to make a point. So if we zoom in on RG3 here, he's wearing a brace. So it is certainly possible to tear your ACL while wearing a brace. It's not like wearing a tank on your knee that's going to kind of prevent it from everything. It's not bulletproof, and so people certainly can tear their ACL in a brace. It also limits his range of motion. If you kind of follow the Redskins, he was complaining about his brace, like on the media the whole time. He went out the first 2 games he was wearing it. He would go out and have it adjusted and put it back in, and they tried taping over it. They tried all kinds of stuff because he didn't like wearing the brace. They did a study on Army cadets. So these are very highly active people, going through boot camp and basic training, and they had a bunch of Army cadets who already tore their ACL and had surgery to reconstruct them. Half of them they braced, half of them they didn't. And in the brace subjects, 2 of them retore at 2 years, and the non-brace subjects, 3 of them retore. So, I mean, there's still more people in the non-brace group, but that's not really significant. So that's basically the same if you look at those 2 groups. And so they saw no improvements in functional performance, but what they did see was that the brace could reduce their running and turning speed. So if you're an athlete or an Army cadet or someone where your performance depends on, every little percentage of performance counts, the brace is going to limit you a little bit. And that's why RG3 complained about it, and that's why people don't like, one of the reasons why people don't like wearing braces. So it actually might decrease your performance without actually improving your protection. So what's an ACL injury prevention program? So this is a program basically designed to take a given population and decrease the rate of ACL injury. And there's huge variation, huge number of programs. That usually consists of supervised exercises for a given frequency, given period of time. There's 5 that I could find in the literature that have some research studies behind them that talk about their rate of ACL prevention, and they're listed here. They're just names. The 11 is actually a program set up by FIFA, which is the International Soccer Foundation, for preventing injuries in general. And then the rest are just different programs that have been, done by different people. So, and they're all a little bit different. So some of them focus on strength training, some of them do flexibility, some of them use special equipment like balance bands and boards. Some of them are during the season, some of them are in the preseason, some of them it's kind of optional, you could do it either way. And you can see there's a big difference in the commitment of time. So we don't talk about that enough because if you're training for a season, you want to get ready for your sport, and then you're spending all your time preventing your ACL from tearing, then you might not want to do that program. You might not feel inclined to do that. So the sports metrics can be 60 to 120 minutes, 3 days a week for 6 weeks, whereas some of the other ones are 15 to 20 minutes. So what does the data show? Well, really only 2 of these programs actually have been shown to reduce ACL tears. So sports metrics, they took a group of trained females, 366 of them, none of them retore their ACL over the study period. They had control females, so they didn't have any training, and 5 tore. and then they had control males, they had 1 tear. So they didn't take any males and train them, and the reason for that is because you're trying to show a difference. And so if you want to see a big difference, you're going to take the group with the highest risk, which is going to be the females, and then you're going to train that group and try to show a difference between females and males. And then the PEP program, they have 2 different studies. One was on high school soccer females, one was on college soccer females, and both of them basically showed that in the train group there was a lot less tears of the ACL. Now this is a big group, so like in the first high school group it's like 2,000 people they trained, and like about 4,000 they didn't. So they had like really big numbers. It was all in females, and it's all females playing soccer, because that's kind of like, if you're talking about ACL injuries, that's kind of like where the money is, right? Because female soccer players, that's like your picture of an ACL tear. What else can we measure? So there's a lot of things besides just re-tearing your ACL. We can measure things like athletic performance, abdominal strength, agility, hip muscle strength. And so each of these studies kind of measured some of these things. It's not like any of the studies measured all of them, but only 2 of them really, 2 of the studies only showed like a significant improvement in any of these things. So sports metrics and the PEP program, and only 1 of the PEP studies showed some improvement in some of these categories of function. And how much does it cost? So the sports metrics program, it kind of depends. They have different options on their website, but it's somewhere between $150 to $300, depending on whether you get like a bunch of videos mailed to you, or if you go to a certified trainer and have like exercises done with them, and also like how many sessions you participate in. The PEP program is actually, that requires some investment from the team. So it doesn't have a specific cost, but it involves, it's during the season, so you do it for like 3 times a week before practice as kind of a warm-up to the actual practice. And so the coaches or the assistant or the trainers with the team would participate in doing the PEP drill. So sport metrics, just a little more information about it. Apparently, I didn't know this, but apparently in the DC area, if you want to do the sports metrics program, it looks like there's several locations where there's certified athletic trainers or physical therapists that are trained in these things. So we're lucky to have this available to us. It was developed by Frank Noyes, who's an orthopedic surgeon, and it involves preseason training, 6 weeks, about 3 to 6 days a week. I think most people probably do 3 days a week. And the PEP program, like I said, that's done with your team. And if you go on the PEP website, they have like a whole this diagram of like how you set up the field, and they'll do things like they'll have a warm up, and then stretching, strength training, agility, and plyometrics. And this is all in like 15 to 20 minutes, and then you go do your practice. It was developed in Santa Monica. And so it's not really like you wouldn't go somewhere extra from your sport, but it would add time to practice. So what's the answer? Well, we don't know, right? Because what is it worth to you to prevent your ACL from tearing? So you as an individual have a low chance of tearing your ACL, but if we take this room as a group and we wanted to prevent ACL tears, if everyone in this room was a female soccer player and we all did the study, maybe we would prevent an ACL tear. But for each individual person, you have to measure like whether that's worth it to you. It involves a complex combination of mechanisms to cause an ACL tear, and as we talked about, the prevention programs can be costly or time-consuming. So it's taking time away from practice, or it's taking time away from being able to relax during the preseason. And so, I mean, for some, I guess, opinion advice, I would say that I would probably recommend that people who are at a very high risk of tearing their ACL, so maybe like high school and college female soccer players, or female athletes in general that do a sport that involves a lot of cutting and pivoting, probably do these programs. For everyone else, I think it helps, but I don't know if we have enough. I don't know if we have enough answers to say it'll definitely make a difference for you. So it's kind of depending on your interest. If you have, certainly if you have a brother or sister that tore their ACL, and then you'll be more focused on preventing it. Whereas if you don't know anyone that has an ACL tear, it may not matter so much to you. So, thanks.